I'm going to be speaking about perinatal anxiety, and I think it's important first to establish what does the term perinatal mean. It really simply refers to the time period from conception to the first year after the baby is born. And there is a focus on the common mental disorders around this time because they're common. And the common mental disorders are depression and anxiety. And depression gets a lot more press, but we tend to forget that anxiety around this period, during pregnancy and that first year after the baby is born, can actually be as common as depression and can be equally debilitating. It can really affect how people function and how people cope with motherhood and with being pregnant. I think it's important to realize also that the symptoms of depression and the symptoms of the anxiety disorders are actually rather similar. And a lot of women can experience both at the same time. So just because a person has depression doesn't necessarily mean they won't have a range of other mental health problems like alcohol or substance use disorders or one or more of the anxiety disorders. And we find that some of these disorders actually cluster together. The anxiety disorders are really a bunch of disorders that are clumped together under this category anxiety. And there are a lot of similarities between the different types of anxiety, but there are some particular differences too. And that may or may not be so important with respect to management, because a lot of the treatments for depression would be the same as for anxiety. But I think it is important to understand that anxiety disorders can sometimes present differently from depression, and people might not realize that they are suffering from an illness that can be managed and that they can get better, that they can get help. And I think that's an important message to realize, is that people, when properly managed, do get better. And there is evidence for a range of different management approaches that help people get better. So I think it's extremely important for families and for mothers themselves to realize that with the proper management, people get better from these common mental disorders, both from depression and anxiety. Quite often the treatments are very similar for depression and anxiety. Sometimes one needs more than one treatment approach. So I think it's important for people to realize that people get better from the common mental disorders when they're properly managed. So the earlier these are picked up, the more people engage holistically with different management approaches, the more likely they are to get better rather rapidly. The more they get support from their families and their communities and their health providers, the quicker people do get better to a full functioning, joyful life. So what are the different anxiety disorders? Before we discuss what they are in particular, there's some common features of anxiety per se, and it might be helpful to consider them with respect to the emotional features and the physical features. So there are a lot of emotional features associated with anxiety that are linked to excessive worry. So if one is living in a situation where it is warranted to be worried, if one's living in a war zone, or if one's security is under threat, or if one's finances are under threat, it is ordinary and healthy to be worried about these circumstances. But when this feeling of worry is persistent and ongoing and there for most of the time, over a long period of time, and it affects how one thinks about the world and how one thinks about oneself, and it affects one's ability to concentrate, it affects one's energy levels. When this worry is pervasive and part of one's thinking and feelings for a lot of the time, then one may be concerned that there is an anxiety disorder. And then the anxiety disorders are often usually characterized by a lot of physical symptoms as well. So there's restlessness, there's muscle tension and aches and pains. There may be symptoms in the gut. diarrhea, cramping, bloating. There's typically symptoms of excessive sweating or palpitations. People with anxiety struggle to fall asleep, or they may well wake up early in the morning with very troubling thoughts that are intrusive and persistent and keep them awake and keep them from dropping back to sleep again. With these general symptoms around anxiety in general in mind, it might be helpful to look at what are the particular anxiety disorders that are present. People who experience anxiety disorders may attempt to self-medicate with alcohol or substances. Of course, this will make the situation much worse and may end up causing depression or making the symptoms of anxiety more exaggerated. The alcohol and substances will obviously impact on the pregnancy and on the developing fetus in addition. The most common anxiety disorder is generalized anxiety disorder, and the name speaks for itself. This is an anxiety disorder that is typified by people feeling anxious about life in general. They see and experience a sense of doom, a sense of general threat in the environment, in their lives, in their daily lives. They consider the worst case scenarios, potential disaster and catastrophe, and these are pervasive feelings that impact functioning. So it may impact how people are in their relationships with others. It may impact their behaviors at work. There may be a lot of checking, a lot of redoing of things, and it may impact the relationship with in our case, in the perinatal period, it may impact the relationship with the baby. Women with anxiety and depression, in fact, may have problems with the letdown reflex. So lactation or breastfeeding can be a problem, and people might struggle with relaxing enough and feeling confident enough that their bodies can produce milk and that they're holding their baby in the right way for breastfeeding to occur. Quite often the baby might pick up on that anxiety. Babies are very well attuned to pick up the emotional states of their parents, both parents. So they may respond to this and also have problems with feeding. So generalized anxiety disorder is a diagnosis that can really only be made after somebody has experienced the symptoms for about 6 months. So it might be ordinary and normal and healthy to have these symptoms over shorter periods of times when there's a threat in one's life, when a relationship has broken down, when one's having a sick and ill relative that one has to care for, when one's having extra responsibilities, when there's some kind of a threat to well-being. It's ordinary to have those symptoms of anxiety, but when they persist for a period of 6 months and they are disabling, then a person may have a generalized anxiety disorder. So with those general features of anxiety, I think it's important to realize that around pregnancy, those experiences and those thoughts will be filtered through what's happening in pregnancy. So the focus of the anxiety may well be on the pregnancy itself, whether the baby's going to be well, what the delivery is going to be like, whether there's a problem with the growth after the baby is born. The thoughts and worries will circle around the safety of the baby, whether the baby is developing in the correct way, what's going to happen around the growth monitoring and the immunizations. So the flavor of these anxiety symptoms is filtered through the experience of what's happening in the person's life. So, for instance, if one's experiencing anxiety at another point in one's life, it'll be filtered through what's happening in that context and in that environment. So what are the risk factors for experiencing anxiety in the perinatal period? Well, a lot of the risk factors are the same as those for depression and the other common mental disorders. But certainly for women who are experiencing social problems, for women who are experiencing financial problems, particularly problems in close relationships with a partner where there's conflict or a loss of a partner, where women have had previous traumas before, and especially where there's been a previous loss of a pregnancy from any cause, a stillbirth, a termination, a baby who may have died, a miscarriage. Quite often those traumas may be re-experienced in subsequent pregnancies or reprocessed in that way, and that's when the anxiety features can re-emerge. The other risk factor for anxiety is poor physical health. If women are experiencing chronic physical conditions, that can also place them at increased risk of mental health problems such as depression and anxiety. And particularly women who have HIV, they are about doubly at risk of experiencing anxiety and depression around pregnancy. So panic disorder is characterized by a series of panic attacks that people may experience out of the blue, without necessary any warning, without necessary any event that may precipitate them. And these are very discrete experiences of panic, where the person is feeling a terrible, extreme sense of doom and fear. There are a lot of physical symptoms associated with this episode. People might feel that they're struggling to breathe, they are sweating, there's shortness of breath, there is a sense of impending catastrophe and doom. And in between panic attacks, people who suffer them may be quite preoccupied with the concern that these attacks may happen at any time out of the blue. So when is my next attack going to happen? What am I going to do about it? It might be extremely debilitating. It might cause an extreme amount of shame and an inability to function at the time of the attack. And again, women who've had previous trauma or terrifying events around the pregnancy period, around health concerns, if those previous losses or traumas have not been processed at the time, they can re-emerge in the pregnancy period and present for the first time in pregnancy with panic attacks. And quite often, health workers can be very bogged down in exploring what are these physical symptoms without realizing, in fact, there isn't an underlying physical condition here. That these extreme physical attacks are an expression of a deep internal process of anxiety. It's very important to realize that depression and anxiety can coexist together and often do, but that even if they don't, if somebody is experiencing one of these disorders and not the other, the symptoms, many of these symptoms are very similar. So for instance, women who are struggling with sleep, this sleep issue may be a result of depression or anxiety. And of course, sleep may be a problem associated with having a big belly and being pregnant or having the physical complications of pregnancy. But when one looks at these symptoms, it's important for mothers themselves, the people who are around them, healthcare providers, to try and tease out what's behind these symptoms, what's behind this inability to sleep. Is it worrying thoughts? Is it a urinary tract infection? Is it feeling very low and very depressed? Another common symptom that is similar across depression and anxiety is the symptom of exhaustion, which may or may not be linked to sleep deprivation, but feeling extremely tired, having low energy levels. And linked to that might be difficulties with concentration and motivation. People who are anxious might be quite irritable and might come across as being aggressive. But in fact, this aggression or this anger or irritability or restlessness is simply a symptom of underlying fear. And all people, all animals that are afraid respond in one of three primal ways. One can fight, one can flight, one can run away, one can avoid, or one can be frozen in the moment. And those are essentially the general symptoms that people with anxiety may be experiencing. You may find that they are aggressive, they lash out at times, they can avoid appropriate health visits and health-seeking behaviors, they can avoid relationships, they can avoid difficult discussions because it's just too frightening for them. Or they can be stuck and frozen in a space where they cannot initiate or move on. And it's important to understand that these are features of the illness, and the person is not being immoral or difficult on purpose or rude on purpose. These are symptoms of the underlying condition. So linked with this flight response that people who are afraid or anxious experience might be a situation where mothers are avoiding help, and not just only avoiding attending their doctors or doulas or midwives or nurses, or avoiding speaking out that they're suffering, but they may avoid seeking the ordinary help that may be available to them. They may not reach out to their partners, to their family, to their loved ones for practical help, never mind emotional help. Their self-esteem may be compromised. So the feeling that asking for help is linked to an indication that one has failed is often quite prevalent. In general, anxiety, as you can imagine, just like depression, can then affect how one plans and manages one's daily tasks, the general business of living, how one thinks and organizes one's day, how one prioritizes, how one draws in other resources and activates potential avenues for problem solving. All of those things require somebody who's well in themselves to do effectively. So that really gives you a sense of how anxiety can impact functioning in general. I'm going to speak about post-traumatic stress disorder. That's often called PTSD. It is more common than people originally thought, and it is characterized by a person who has previously experienced some kind of trauma. It need not be a violent trauma, but people who have experienced some kind of violence, sexual trauma, torture, attack, some kind of invasion on their physical space, as well as other kinds of traumas such as natural accidents or traumas related to unexpected bereavements or losses. If that incident is not managed well, and if they are not able to process that trauma in a healthy way, they can go on to experiencing this post-traumatic stress disorder. And what that means is that traumatic incident is re-experienced very vividly for people. They experience the incident again, almost as if it is happening again. So some of those smells or sounds or the physical sensations may be re-experienced when they're not happening. And as you can imagine, this would result in being very fearful. So that is why it has been considered a part of the anxiety spectrum of disorders. People are hyper-arousable, so little noises can cause them to jump. They're much more irritable. Their sleep is often severely impacted, with vivid and distressing dreams recurring again and again and again. And of course, PTSD can affect functioning. It can make people avoid certain circumstances, not only avoiding the similar situation that caused the trauma in the first place, but they may start avoiding the general healthy interactions that might in fact help them to get better. So for pregnant women and women in that postnatal year, there may actually be quite a lot of past traumatic events that may re-emerge for them in this time, especially women who have experienced sexual trauma in some form, whether there has been attack, abuse in the past, or rape. Quite often those traumas can cause PTSD symptoms in the perinatal period. There is also investigation now into how traumatic birth experiences or physical complications around pregnancy for the mother or the baby can cause subsequent post-traumatic stress disorder in the next pregnancy or in general or around the time that the trauma has happened itself. So women who've had an unexpected emergency cesarean section where there's been a bleed and people have had to be rushed into hospital, where women have had to be bed-bound for weeks at a time because there's been a complication in the pregnancy, where the baby has been born premature and there's been a long period of time when the baby's been in an intensive care unit or has needed a lot of procedures. A lot of mothers and fathers can experience these events as extremely traumatic and develop the symptoms of post-traumatic stress disorder afterwards. Obsessive compulsive disorder is another anxiety disorder that's relatively common. And women who've experienced this disorder prior to pregnancy might find that the symptoms get worse during pregnancy. So obsessive compulsive disorder, or OCD as it's often shortened to, is a disorder where people have very distressing and disturbing persistent obsessions or thoughts that are intrusive and come again and again into one's mind. And around pregnancy or in the postnatal period, these thoughts may well be centered around what's happening with the pregnancy, with the baby, with the development, with issues of health and safety, with issues of how one's home is equipped or ill-equipped to take in a new child, the details of being ready to have a child in the home, the financial issues can all turn into very intrusive, obsessive thoughts. And because these are so anxiety-provoking and occur so often, the compulsions or the behaviors that result are often resulting as an attempt to pacify those obsessions. So the behaviors are actions which are the mind and the body's way for the person who is suffering to try to feel better about obsessions. They're not necessarily in conscious control, and the behaviors are typically about checking, making lists. A person might repeat the same phrases again and again. The checking can in fact be quite dysfunctional. So a person may check the locks or the safety or whether one's turned off the stove again and again and again, even if one's checked initially whether the car has been properly locked, whether things are in place for the baby, whether there's adequate preparation. The checking is often quite debilitating. There are often compulsions around cleanliness as well, so people might wash their hands excessively or wash their bodies or clean their homes excessively. And these behaviors or compulsions, as I said, are really an attempt to try and allay, try and pacify the very disturbing thoughts and obsessions that are causing such distress for people with OCD. Then the various phobias are also anxiety disorders, and there are a range of phobias. Common ones are agoraphobia or tocophobia. Agoraphobia is the irrational fear of going outside, being in public and connecting with other people. And as you can imagine, this would result in a vulnerable mother becoming increasingly isolated, placing her again at increased risk of depression and other features of anxiety. Isolation, which is a common feature of all the anxiety syndromes, tends to make all the symptoms much, much worse. Not only are people unable to get the support that they need, they're unable to connect with other potentially caring individuals, but being isolated leaves, especially an anxious person, alone with internal worries and thoughts that can escalate. So agoraphobia is where women may well result in being increasingly isolated, and their families and health workers need to be aware because they may not be seeing them very often, and it may be a result of this phobia. Another phobia is called tocophobia, which is the irrational and extreme fear of childbirth and labour. And this is more common than originally thought. It has been found that about 1 in 7 women across all cultures and in all social settings may experience tocophobia. It is often related to previous traumas, sexual trauma, violence, or previous traumas related to childbirth. So where women have had emergency birth situations, they've had complications in labour, or they've had sick babies and infants, or they themselves have become very sick in previous pregnancies, that can result in a fear of the labour and the delivery in a subsequent pregnancy. And if this fear is not adequately managed and treated during pregnancy, it may be kinder, more therapeutic and safer to deliver women with tocophobia via elective caesarean section, where you can actually plan to have the delivery in a safe, controlled, calm space. There are women who do get better with various forms of management and therapy and can go on to have an unfrightening and calm birth with the right support and with the right care at that time. So in summary, anxiety in pregnancy and in the postnatal period is common. About 1 in 5 to 1 in 7 women will experience one or more of the anxiety disorders. They often go together with depression. The symptoms are very similar. We can use our families, our partners, our health workers to help detect it early in pregnancy, but even if it's detected late, there are a range of ways in which to manage these disorders so that you can get better and enjoy the right to have a well and joyful time around motherhood, around the development of these new relationships in your home. Women with anxiety disorders can get better and do get better with the management options that are available. And these women may go on to experience joy and well-being in motherhood despite the difficulties and despite the challenges. And that is what we want to aim for every single mother who comes into our ambit.